The research is important for two main reasons. Firstly, as a sector, we don't know enough about the costs of caring for people at the end of life, and commissioners need this kind of information to make informed decisions about where to allocate resources so that we can get the best care for people with a terminal illness within the money that the NHS has got. Secondly, the work that the Nuffield Trust did in 2012 to evaluate the impact of the Marie Curie nursing service on hospital costs left a number of important unanswered questions about the extent to which the hospital cost savings that they identified might be offset by greater costs of caring for people in the community. The Nuffield Trust used a number of different approaches to analyse the cost of caring for people at the end of life. For some areas of costs, such as the time people spend in hospital, there are large national data sets that we can analyse and link together at the person level. For other areas of costs, such as GP visits and district nursing care, those large national data sets don't exist, and instead the Nuffield Trust had to rely on smaller studies. For example, for district nursing, a study that involved one London borough. But for each of those areas of cost, they looked at how much activity there was for people in the last 90 days of life, applied unit costs to that, and then added them all together. The key findings of the research fell into two main groups, one about the cost of caring for people at the end of life in general, and a second set of findings about what this tells us about the likely cost of caring for people who use the Marie Curie nursing service. So for people at the end of life in general, some of the interesting findings were around the scale of the costs for different elements of care. So the cost of GP visits was about £150 in the last 90 days of life, and district nursing was about £300 per person who died in the last 90 days of life. These are relatively modest compared to the cost of social care, which is about £1,000, and the cost of hospital care, which is about £4,000. So it gives us a good indication of the scale of those different costs. What it also told us was some new information about how those costs change as people get towards the end of life. So GP visits, the cost of those was relatively consistent over the last 90 days of life, whereas the cost of district nursing care increased considerably in the last month of life. Secondly, this work filled in some important gaps in the work that was done in 2012 evaluating the Marie Curie nursing service. What it's told us is that even when you include the cost of GP visits, district nursing care and social care for the extra time that Marie Curie nursing service patients spend in the community compared to matched controls, when you add all of that up together with the cost of the service itself to commissioners, you still find that there's about a £500 saving for the total cost of care for Marie Curie nursing service patients compared to those matched controls.